Okay. Jumbo, everyone. These are Marafiki Wazungus. So my name is Haley, and I'm a sophomore at the University of Arizona. Just kidding, I'm going to be a junior. And my major is microbiology and a minor in deaf studies. And future career goals, I'm thinking I want to specialize in infectious disease, but also be a PA in infectious disease. So I'll have my friends introduce themselves. Whoever wants to go.
I'll go. Alright, so my name's Alexis. I go to the University of Arizona. I'm a nutritional sciences major with minors in public health and biochemistry, and I'm hoping to become a pediatric oncology PA.
Okay, I'm Krystal. I'm a senior at University of Arizona. I'm a nursing major, and I want to become a neonatal nurse practitioner. And I'm from the U.S. also.
Yeah.
My name is Hannah. I go to Northern Arizona University, and I am going to be a junior. I'm a nursing student who wants to work in labor and delivery and eventually become a nurse midwife.
Alright, awesome. So I think next we should probably just talk about maybe how we each found Tide Global elective. So I know for me, my BFF Hannah here, she came and talked to me about it because we've been friends since junior high, and we always dreamed about going to Africa and doing a mission trip, and this opportunity came up, and she came to me and was like, "Do you want to go to Africa with me?" And I was like, "Obviously, yes." Dio. So we ended up signing up, and actually one of my friends in a club that I'm in called Alpha Epsilon Delta, it's a pre-health fraternity at the U of A, Courtney Cox, she talked to me a lot about it, and she just loved the program and raved about it.
Alright, so we've always wanted to go on a mission trip to Africa as well, and I actually met one of the board members, and she also went on two trips previously with this organization, and she told me about it and her good experience, so we thought we'd give this organization a try, and that's why we decided to come this year.
Here we are.
Yeah, and I heard about it from a friend in chemistry class. We, on the first day of chemistry class, when I did go to University of Arizona, talked about what kind of nurses we wanted to be, because I was in a nursing-specific chemistry class. And when I mentioned I wanted to be a midwife, one of the other girls had said she, for the previous summer, had gone on a trip with Tide Global and told me about it, and that was 2 years ago, so now I'm here.
Here we are. So
overall, I've had a really great experience. I've been able to learn a lot, and you definitely see a lot of things here that you don't see in the U.S. And you also get to go really close. You get to be in the rooms, observing surgeries, and really getting to know the patients along with the physicians, and see how the medical care here differs from back in the U.S. So it's a really eye-opening experience, and I think everyone should really give it a shot.
So from my experience, I worked in many different departments, which was really nice. I worked in casualty, pediatrics, surgery. I went to the NICU a few times, so I really liked how you can go to very many different departments. And then the doctors are really willing to teach you hands-on, go step by step and make sure you understand what they're doing.
yeah, you definitely have to jump in, because with this experience, it is what you make of it. So if you want to learn how to suture, if you want to see a surgery, get in there and ask, and you will receive, really. You'll find a lot of doctors who are more than willing to teach you, and I had a great experience. I've learned so much. There's so many cases here that it's very hard, you wouldn't really see in the U.S., especially me being so interested in infectious disease. There's lots of diseases here that are very just not prevalent in the United States, so which is also very tragic, but very unique to see, and it's definitely very different from the United States healthcare, and I think it's important to see and to connect with a different culture and a different type of community.
coming from working in a hospital back home, it's very easy for me to see the differences in the supplies and the advancedness when it comes to medical care. So in a way that can be kind of frustrating, because when you know of things that could help and they are not available, it can kind of be frustrating. But I agree, like, you can very easily stand back and watch, but if you want to really accomplish and do things on your own and hands-on, then you really have to jump in and kind of be brave and eager and really show these doctors and other medical professionals that you're really wanting to learn. But, for sure.
Alright, I'll go first. So I really enjoyed the safari. We took a plane to Nairobi and we went on the Masai Mara safari, and I think everyone should give it, I don't know, everyone should just go. It was it was a great experience, really. You got to see all the animals and in their natural habitat.
So crazy. I never thought I'd see a giraffe outside of a zoo.
Yeah.
Twiga.
It was amazing, and there was lions, and they were only about 15 feet away, and they were just sleeping. It was amazing, and the hotel as well was beautiful.
Really nice.
Yeah.
Really nice.
And if anyone else comes on this trip, I definitely encourage you to go on it, because it was one of the highlights of this trip for me.
I think for me, like one of my favorite activities we did was definitely go to the baby orphanage. These little kids are just so precious and so sweet, and they have so much love to give, and I just loved hanging out with them all day. So cute.
I mean, I could spend every waking second at the beach, no matter what. I really could. But, I mean, even back home, like, I love the beach. It's my happy place. So I loved coming and visiting a new ocean, and the sand and the water. It's just absolutely beautiful. I could spend the whole day there. But also, like, I really loved the school. We got an opportunity to go play and kind of see how the educational system was here and teach. We did a hygiene clinic. That was really a lot of fun to do that. I thought it was hilarious that I brushed my teeth, like, in public. But yeah, I mean, it was so fun, and they're just so eager to get to know you and for them to share themselves with you. So.
And then I really liked the excursions we did. We went on a 2-day trip to go scuba diving, which was really cool. The water was so clear, and you could see all the different types of fish and whatever else was in there. But yeah, what else did we do?
That was fun. Accommodations. You always have a driver. There's always somebody here that's making food for us. We get, how many? 3 meals a day?
4.
Plus tea time. So you
4,
get some
yeah.
snacks, tea.
You get fluffy.
You get fluffy, maybe. But it's always good. And if you ever have a problem, you can always let somebody know. And if you don't like a food or whatnot, there's always somebody to fix it.
Yeah.
So I definitely recommend everyone to go on this trip, because you really get to learn a lot about the culture and how healthcare differs from here to the United States. And also, too, if you're interested in the medical field, this is a great place to really learn, because you'll see a lot of things here that you don't see back in the States. And I definitely was able to learn a lot more than I've been able to learn in many years back home. So,
For sure.
yeah, I would definitely recommend everyone going on this trip.
Yeah, it was very fun. It's hard. Sometimes you get a little homesick, but I mean, it doesn't compare to anything you could learn in America, that's for sure, or really anywhere else that I know. You not only gain the culture and learn a different language and just see how, another culture just communicates and as a community, just as how they coexist as a community, but you also learn the whole, the entire field of medicine if you want. I mean, you can go anywhere in the hospital and completely just, I feel like I'm going to go back to school 5 steps, if not 1,000 steps ahead of everyone else.
Yeah, for sure. I loved coming to Kenya. The people here are so friendly. The culture's so different from the U.S. You just walk down the street and everyone's like, Jumbo, Jumbo, says hello. Everyone's so friendly and welcoming and accommodating. And I just loved being able to see all the unique things at the hospital and getting to actually become a part of these patients' lives, even if it was only for a week or a day or whatever, because you can see in their face how much they appreciate your help and your assistance, and just even saying hello, they just appreciate that in their hearts, and it's really interesting to see what a difference it makes and how grateful they are just for a friendly face, I think. And I want to come back. Give me 2 years and I'll be back here in Kenya.
Once you land, someone will be there, right? Like, with no worries about being outside by yourself. They were there early, at least half an hour early. And then they transport you to the residence, and then when you go home, they'll make sure you have a ride.
You get there on time.
And I
Get
think,
there on time.
yeah, and I think also just like one more thing to add, when I was deciding to come on this trip, I really struggled with like, how long do I stay? And like, what if I hate it? Or what if I love it? And so I decided on a month, and I think that's a perfect amount of time. I mean, if you don't want to take up your whole summer, I would stay here for 3 more months if I could. I just love it, but if you want to come and get really the most out of your experience, I would recommend going for a full 4 weeks.
Yeah.
All right.
All right.
Karibu.
Kwaheri.
Kwaheri.
It's
What? Oh,
Swahili.
gosh. So many.
So many.
Kwaheri. Habari asubuhi.
Kuma.
Kwaheri. What's Toka? Toka.
Toka.
Twiga.
Okay.
Twende.
Twende.
I don't even know. I can't even think of any.
Mm.
Mambo, Pua, Hali, Fiti, Gemma.
Ah.
You learn a lot here. Let's pick it up.